too. Okay, great. So yes, again, thank you everyone for being here today. And I'm sure this is going to be an insightful session for you. And we're going to talk about today health and systems change, and especially how can we reframe the idea of challenge or complex challenges to a more systemic way of thinking about them. So quick agenda here. We had our 5 minutes of introduction already. Then I'm going to introduce the topics of systems thinking and systems change. Afterwards, we're going to have a brief case study demonstration, and you're going to use the Miro board as well to put your ideas here, and we can have a discussion afterwards. Then I'm going to separate a time for Q&A and comments if you'd like to address anything in particular. And then a minute or 5 minutes in the end for wrap up and ways to connect. Okay, so this session is going to take 60 minutes. We're going to have, as I said, a Q&A moment for you to mute yourselves and just share your ideas and questions. You're more than welcome to use the chat. I'm going to be looking at it as well. And I'll just kindly ask you for you to stay on mute during this presentation so we don't have feedback and background noise during the session today. Okay, so we can get started. And I think the context of this presentation is going to be around physical activity or physical inactivity, right? And I would like to share some numbers here before we start. So Sport England Active Live survey showed that 25% of adults are currently deemed to be inactive in England, with over 11 million doing less than 30 minutes of activity in total a week. 53% of children and young people are not meeting the CMO's guidance of at least 60 minutes of activity a day, with 23 being fairly active, but 30 doing less than 30 minutes a day. And lastly, NHS statistics from 2021 to 2022 indicate that almost a quarter of year 6 children were obese in England, an increase of 3% from 2018 to 2019. The last figure is recorded prior to the COVID-19 pandemic. So I think the question here that emerges is we have so much technology, we have so much understanding of so many different topics, and I'm sure we have a lot of brilliant people in the healthcare sector working, dedicating their lives to this challenge of physical health or physical inactivity. And today we can see that these numbers are increasing, right? So it makes me wonder why that is. And I would argue that we are dealing with a specific type of challenge or a specific type of problem. And that's where I would like to introduce you to the idea of wicked problems or wicked challenges. Have you heard of this before? Maybe thumbs up, physical thumbs up if yes or no. Okay, some thumbs up. Physical or not digital. Great. Yes, so you're familiar with that, right? So differently from the idea of tame problems or more simple problems, these very specific wicked problems, they have some characteristics, right? And some of those are they have no fixed solution. So it's not that we're going to put something around these problems and we're going to fix that, because that's not how the nature of these problems actually organized. Then, of course, they're multidimensional. So when we talk, for example, about physical activity or obesity, children obesity, we're not just talking about health care system. We're talking about, of course, policy, government, we're talking about education, we're talking about engineering, we're talking about design. All of these are actually very important perspectives to take into consideration when dealing with childhood obesity, for example. Conflicting opinions. So when you probably know that a lot more than I do, people have different ways of perceiving how these challenges can be solved, right, or sorted out. So some people say that the answers may lie on the children themselves, or maybe in the governments, the parents, the institutions, and all of the above, none of the above. So they're very conflicting and diverse opinions on how we can actually tackle these types of problems. And another characteristic of these wicked challenges are they are highly dynamic and open-ended. So it seems like they are not going to end anytime soon. And of course, we can see the influence of all these elements all the time in the actual emergence of the problem itself. So that are some of the characteristics that constitute wicked problems. And for these types of challenges, it's very important for us to reframe the way that we think about what is a challenge and how to, quote unquote, solve them, right? And that's where the idea of systems thinking actually comes to life. So systems thinking essentially is a framework that helps us to think about the challenges that we have at hand in a more relational, contextual, and dynamic way. So it's not just a cause and consequence. There's a lot more to it than just, for example, a puncture in your wheel, or something like a light bulb that is not working in your house. So this new way of thinking about challenges and problems moves us away from a linear, very analytical way of thinking, and allows us to think more holistically and comprehensively about the elements that are actually involved and they are in the workings of the actual problem itself. And I think this image here allows us to really have a sense on the nature of these wicked problems, right? So when we think about a simple solution to wicked problems, they may be of use from one specific moment or another, right? But if we actually stop to see the development of this problem, we see that sometimes, more often than not, these same events are going to re-emerge. They're going to appear once again after a while, or even worse, what we call the unintended consequences, right? Some other types of problems are going to emerge that we weren't really thinking, that we didn't really consider before. And that's because the problem doesn't lie in the actual event itself. It lies in the underlying structure, very complex, dynamic, adaptable structures that we have within the system itself. So systems thinking is really a tool for us to reframe the way that we approach these problems, and then helps us consider why instead of how of these problems. Helps us to put ideas into perspective rather than just having very simple and straightforward solutions to the first things that we normally see. So systems thinking is a very powerful framework that helps us think more critically about what we have at hand and normally the phenomenon that we see. And here I'll just briefly show you this iceberg model that maybe some of you are familiar with, that I think is extremely important to helps us deepen our understanding and complexify, as I like to say, our understanding of the problems, right? So if we think about, again, child obesity, we can see that as one event, right? And this is in the first layer here of the iceberg model, observable actions and phenomena. So this is what we see, normally the tip of the iceberg. But if we stop to as I said before, think about why and maybe put that into perspective, we can start to go deeper into this iceberg and think about root causes of this challenge. So the second layer of the iceberg is patterns that describes trends over time. So going back to this idea of the childhood obesity, why is this child obese? Maybe there's a trend happening in that specific city, region, or even a specific TikTok trend or whatever. Or maybe it's a generational pattern that we can see that allows that event, that observable phenomena to actually exist, right? And this is another way that we can actually understand the challenge that we have. So a deeper structure, a deeper layer to this iceberg model is the structures. So here we can ask how the parts are interrelated to influence these patterns that we can see here, these, let's say, generational patterns. So what is the infrastructure that is around the city, for example, that allows people to choose specific types of food than others? Is there enough ways for people to walk around their space and green spaces, for example? Are there peers really into exercise and so on, right? If not, that's another thing to really consider, that is actually influencing, again, these events. And lastly, one of the most important layers of the iceberg model is the mental models, or belief systems, or attitudes, or culture, right? So this supports everything else in the system. And this is a very important one because this is normally the unhidden one, the unspoken layer, right? And normally these ones are actually so embedded in our way, in our lifestyle, in our ways of thinking about the world, that we don't even consider that to be an element of influence in the system itself. So these mental models are extremely important for us to really deepen our understanding of these complex challenges. And then from here, we can start to think about ways to maybe influence some change in these complex challenges, right? So here I put some examples that used systems thinking to reframe some specific challenges in healthcare. So here, for example, is a paper on using systems thinking principles to think about the quality of services in hospitals and other healthcare centers, which is very interesting. I put the reference all in the end. I will let you, I will give you the link to this presentation so you can go to the references afterwards. Here, for example, systems approach to asthma treatment. Very, very interesting. It's not just one simple factor, right? There's a lot of different elements that are influencing the emergence and the prominence of asthma in that specific people and so on. Here, the usage of systems thinking to rethink the waiting list or the queues in the NHS facilities, which is extremely interesting as well. And here, the map, as it says here, obesity systems map. So look at all the factors that in this specific case, they found out are actually influencing the prominence of obesity, if I'm not mistaken, in the USA. So here, for example, if we look deeper, we have psychological ambivalence, we have force of dietary habits, we have physical activity. And another one that I thought was quite interesting here is peer pressure, right? That is very distant from the actual center here, but influences somehow this overall challenge. So very important things to consider and to pay attention to when we talk about complex challenges. And here I'd like to share, I thought it was a very easy and accessible example on the usage of the iceberg model in thinking about hospital overload, let's say. So this is the challenge. Busy hospital where staff shortages lead to heavy workloads and staff burnout. As a result, many staff quit, causing even more staff shortages, heavier workloads, and even more staff burnout. So as you can see, these elements are influencing each other, and we can use the iceberg model to start to think better about this challenge. So in the level of events, the first layer of the iceberg, what is actually happening? What we can see happening here: high workload, staff burnout, high turnover. These are the elements that we can see. But what is behind that? What is deeper into the iceberg? What are the trends or the patterns, for example? One could ask, when does workload go up? Is there a specific constant that allows this workload to increase? Is it seasonal? Does it correlate with other events? Does it happen in a particular unit? Or can we see that throughout units as well? The next layer, the layer of structures, management policies, processes, access to technology, for example. Can everyone have the same access to technologies and tools? Workload distribution, and so on. So this is another very important consideration of why the events. And lastly, the mindset or the mental models. What is the hospital culture that is embedded in this environment? Is there blaming, lack of resources, discomfort with using technology? So in here, we can start seeing how deep and how maybe ingrained in the actual system these specific challenges that we see are. Right? So this is a bit about systems thinking. And once we have this understanding, and once we start to think about a challenge more systemically, then we can start to wonder, are there ways for us to influence change? Or are there ways that we can have more success in allowing a healthier outcome of this context to emerge? And that's when systems change idea comes to life. So when we talk about change, or specifically systems change, we normally get into this idea. There are two main types of change: the incremental, partial, quantitative type of change, and the one that is more transformational, qualitative, non-linear change. And once we talk about systems change, we are focusing more on the second type of shifting the system. So in the same way, for example, this is just an analogy that for a caterpillar to become a butterfly, it first needs to become a robust caterpillar, right? An adult caterpillar in a way. So how does it happen? Through several steps of change. They are essentially incremental, partial change. The caterpillar becomes bigger. There are more cells in the body of this insect, and so on. So these are important changes to be aware of, but these are just partial types of change. But once it becomes a butterfly, it goes to a completely different process, and it becomes a completely different insect, right? So here, this insect flies and moves around the environment in a completely different way. So are these two the same? or are they different? I'll just let you with these questions there. But this is just an analogy for you to really understand the power of systems change when actually done in a way that it actually tackles the bottom layers of this iceberg, let's say, tackles the mental models and the structures of the systems that we see. And to think about change, this idea of leverage points is extremely important for us to really understand where are the points in the system that we can really start to see they have more potential for transformational change rather than others. And going back to this iceberg model, right? We can definitely make sure that the points of leverage, the places that we can intervene in the system, they are going to bring more transformational change, transformational shifts in the system that we'd like to see, are more embedded in the mental models, right? So here, changes or places that we intervene, they're going to tackle the goals of the system. For example, the mindset or paradigm out of which the system, its goals, structures, roles, parameters, and so on arises. And here is where the transcended paradigm actually lies. This is where the actual systemic change happens, right? And this is where we can start to think about new ways of organizing ourselves and organizing the system to become a healthier version of itself. And I really like this quote of Donella Meadows that I think summarizes this idea of mental models and events and different layers to this system very well. And well, it's not her quote, it's just on her book here. The quote is from Robert Pirsig. If a factory is torn down by the rationality which produced its left standing, then the rationality will simply produce another factory. If a revolution destroys a government, but the systemic patterns of thoughts that produce that government are left intact, then those patterns will repeat themselves. Why? Because we're dealing with the events, with the, let's say, in the context of the factory here, we can talk about the machinery, the walls, even the professionals that work there, but these are all here in the level of events. And if we don't go deep to the mental models, to the rationality, as it says here, the system is going to be left standing. And this is where the real, I think, shift in mindset actually happens, when we start thinking about deeper structures than just shallow structures of the iceberg and of systems in general. Okay, so I am going to share now with you, just very, very briefly, a case study of Amsterdam. I put here other case studies for you to check on your own time afterwards when I leave you with this link. But here, essentially, the how Amsterdam used this systemic approach to addressing childhood obesity. And it's actually an ongoing project that they are doing, but it actually showed very important results so far. So basically, they started to dig deeper into why is this challenge is still happening in Amsterdam, and then they started to rethink in this iceberg model. Okay, these are the events. What are the supporting factors? How are the infrastructure organized in order for these children to have this health condition and so on? And they got very, very important results. but I will show you these results very, very soon. I'd like first for us to really think about this idea and play around with mirror board a bit, if you can, right? So I would like to invite you to participate here in the mirror board. If you can't, then you can always use the chat to join, to join the mirror board. I'll put the link here on the chat so you can join me, but you can use the chat or unmute yourselves if you'd like to. Okay. So here in the, how does it work? I'm going to add here in the center the challenge of Amsterdam, right? So urban childhood obesity. And I would like you to join me in identifying some of the immediate factors that could be leading to this challenge here in the center. So yeah, you can use the chat or you can unmute yourselves, but what are some of the factors that you can see that are influencing the central challenge here? Any considerations?
I'll for one. Oh, I'm muting myself twice now.
Good. Go, Jamie.
So, sorry, 1 second. We've got two screens going on. I'll just deal with it. The idea that the cultural norms for children should not really play out in the way they used to.
Sorry?
Helen, help me out.
Or you can use, okay. We have here in the chat, decreasing PE time at school, fast food outlets, great. Other ideas here? Oh. Okay, great. We have in the chat, lifestyle choices of parents. Good. Parents' lack of time to take kids to activities in leisure time, low income, cheaper and healthy. Ooh, great. Affordability of health food, awesome. We have Chown busy being fuzzy eater. Would like to, wow, loads of contributions. Thank you, everyone. Food marketing, great. Parents not believing in benefit of PA. Sorry, let me put more here. Great. Awesome. So those are some of the ideas that you are identifying that are linked to this childhood obesity, right? And thinking further or deeper into the iceberg, thinking about structures and mental models, for example, if we get this example of food marketing, what else is contributing for this food marketing? What can you maybe explain a bit more? Who put that? Oh, Joss. Joss put the food marketing here. What else do you think is contributing to this idea that you put here?
Food marketing. Well, how Well, I guess the whole commercial framework behind food, right? I mean, it's quite amazing what's happened here with obesity, how food has become commoditized and commercialized, and we've built a whole kind of corporate machinery around producing food, and then a whole commercial machinery around it, and how that's been introduced into different countries around the world. And when it does, then obesity just starts exploding, right? Like in Mexico, wherever it is, as they shift from their indigenous food supply to the kind of global corporate food supply, you see almost direct kind of or latent shift into obesity and all these other challenges. And that's obviously driven a lot by the commercial framework behind it, which is expressed through marketing to these children and so forth.
Great. Very good. So here we can see, for example, how building up on what you're saying, social media, right, influences the way that we eat sometimes, not just social media, but media in general. So I'm going to put that for just media here, right? Great. Thank you, Joss. Who put this lifestyle choices of parents? Let's go back to
that was me,
Matthew. Oh, great, Matthew. So this is a good one. So what do you think is contributing to this factor here, for example?
Potentially work commitments of the parents, their lack of time to maybe be physically their lack of time to prepare and cook food because of for example, that could be work, that could be children doing activities, and they just might not be particularly keen on physical activity, not deem it as important, and therefore that might then influence their children.
Not deem as important, I think, is a great point, that it's essentially speaks to the mental models that we're talking about, right? Once you have this belief, then all the other layers are going to suffer the consequences of this bottom, more deep-rooted belief system, right? Physical activity. Great. Thank you. Let me get, let me get just one more so we can continue. Low income, cheaper, unhealthy foods. We put this one.
Yeah, that was me, Mohammed.
Great. So any other thoughts on factors that could be supporting this factor?
That could be unemployment.
Okay.
Educational attainment level, single parenting.
Great. Single parenting. Education as well, you meant?
Yeah, education attainment level. So kind of lower paid jobs.
Mm-hmm. Very good. So here, thank you very much, everyone, for your contributions. And yeah, I can see you had a lot to say here in the chat. Very good. So yeah, here you can start to really see how one specific challenge that we had in the center has so many other factors that are really contributing to the maintenance of this let's say problem right here. And that's when we can start really understanding the complexity of these challenges, and going back to the wicked challenges idea, that it's very difficult for us to tackle exactly because there are a lot of very interconnected elements. They're actually supporting this ongoing challenge here, right? So thank you very much, everyone, for your contributions. And just to go back to the Amsterdam example, so they were very successful actually in putting the systemic perspective into this challenge. And here are some of the reasons they thought it was a very good way to address the challenge that they put in the center there. So first of all, a whole systems approach to create a healthy environment is not just, for example, understanding that the accessibility of sugary foods or just the lack of exercise. It's not just single factors like that, but as they said here, system science focused on public health conceptualizes poor health and health inequalities as outcomes of a multitude of interdependent elements within a connected whole. So going back to the idea of wicked challenges and the interconnectedness of elements, right? Here, another approach to the challenge that they thought it was extremely important to consider. Evidence-based approach to learn and adapt. So how important it is, as they say, it means that the Amsterdam Council must have the capacity to learn, be responsive to new data and insights at its core, and adapt actions in response to such emergent information. Right? It's not just once they understand that something else is actually influencing the challenge, then you need to adapt, learn, and as they say, be responsive to this new information coming to the challenge. Another one, a platform for collaboration and participation. Importance of bringing different perspectives together in order to address this complex challenge. So as they said, the issue was too complex to be dealt within sector silos. So moving away from this separate ways of understanding the participation of each professionals to a more connected, networked way of addressing the challenge. And lastly, they understood the importance of bringing of the government's accountability to the challenge. And since we mentioned about the leverage points, they said that, for example, the municipal tasks have evolved slowly and now include urban development and land use planning, social welfare, public health, social housing, and so on and so on, all of which arguably have an influence on overweight and obesity prevention. So leaving the idea of just events and going more to the idea of the whole iceberg contributing to the challenge at hand. So that was what I wanted to share with you today, everyone. I'll just leave a couple of minutes for questions and answers and comments and so on. But yeah, thank you very much for being here, and I'm happy to hear from you, comments, questions, and so on. Thank you. If you have any.
Thanks for that, Yasmin. Any questions from anybody? Oh, Anthony. You're on mute, Anthony, if you're talking. But
3 years of working on Teams and I'm still finding myself on mute. Right. So that was brilliant. Thank you very much. When you were talking before about team problems and wicked problems and how to approach them, and you said that if you don't approach a wicked problem, if you approach it with a simple solution, then it happens again. I'm working in education. What we hear all the time is persistent. So it's like persistent absenteeism, persistent disadvantage. So that word persistent sort of rung out as, is there a feeling that we're constantly trying to solve complex problems with simple solutions? And is that do you see that across the board? Or is it just in certain sectors that aren't thinking like this? If that makes sense.
Yes. No, I mean, this is general, the way that we think about simple solutions to complex problems is not just in healthcare or in specific sectors. I would say is generally globally, the way that we actually learn to deal with problems is just very linear, right? So that's the mindset or the framework that we use in different contexts as well. So it's not exclusively to healthcare.
I could speak to that. I'm Jasper's colleague from Systems Innovation. Sorry, it's a bit debate here. So yeah, we encounter a lot of simple problems in our lives, right? You think about fixing a light bulb or just opening a door or whatever it is in our everyday lives. We have a lot of very simple challenges, and simple solutions work. And in many contexts, we have those. So then it's kind of natural when we get to something more complex that we try what we know, we try a simpler solution, instead of changing our whole paradigm, our whole approach, and our whole thinking, which is very costly in time and energy and so forth. It's inevitable that we're going to try a simpler or complicated kind of responses to that. And it's not until you get to the point where, as you said, persistence, right? After many iterations, you've discovered this approach doesn't work, but you're actually going to consider maybe we need to change the whole approach here. So there could be many examples of that. You say persistent is a word to use. That's kind of across the board, I would say. But you think about climate change. When we started that actually debate started back, 40 years ago or so, and we took a lot of kind of policy and linear approaches to trying to address that problem because we thought we could fix it. And it's only more recently, right, past 10 years or so, that people are talking about the complexity of that problem, that actually we're recognizing a lot of what we did didn't work. It's getting worse, right? And that this is actually a complex phenomena. So I think it's inevitable that we try to address it with the toolkit that we have, which is a simpler toolkit. And it's not until we really see that it's working, that it's really persistent, that we're going to come along and say, okay, maybe we need to really invest in changing our thinking, changing our approach and so forth, because that's very costly and time consuming to make a paradigm shift. And it's also existentially challenging to change a system, right? You're risking almost the whole system. So it does require that the system really bumps up against its limitations and really has to question, why isn't this working? Why didn't it work before? It's really going to make those big changes unless it's very enlightened.
Great. Anthony has thumbs up. Awesome.
Kate, did you have your hand up, or has your question been answered?
Yeah, well, it was more of a reflection, really, Heath. Thank you, and thank you, Yasmin. That's really interesting to hear you, tell the story. So thank you for that. No, it was more a reflection, really, of the complexity of it, which I know is blindingly obvious because that's why people are talking about systems thinking and how you change. But I suppose it's how I could just imagine if me working in my service or organization, trying to it feels quite brave to try and go and talk to people about we need to do this in a different way, or we need to work with different partners, we need to think about it from a different perspective, and influencing that, how you do that, with external people, with colleagues, with peers, with managers, with chief exec, service leads. That's all when you're one kind of part of it. Sorry, it's not a question, it's a rambling waffle, but it's just really interesting, I think, to kind of see that complexity and bravery and kind of how, almost like Ant said before, like how you keep going to say, no, we need to do this differently. We need to think about this in a different way. We need to talk to other people because ours is only a tiny part of a much wider thing. So yeah, it was just really interesting kind of perspective. So thank you for making me think in that space.
Yeah, no, thanks for sharing, Kate. I think it's a really valid sort of reflection that I'm sure resonates with everybody else on the call. Anybody else have any questions or thoughts or reflections? Jamie, do you want to? I see you putting some stuff in the chat. Do you want to discuss, or you've got, all right, okay, you've got microphone issues.
Yeah, I could speak to that. Well, going back to Katie, what you're saying, you really got to make the system experience the limitations of the way it's doing things, and really make it bump up against the problems and failures and so forth. And also make people aware that there's a different way, and also find the other people who are thinking differently, and then going to what Jamie's saying here, create a shared language around a different way of doing things. I set up systems innovation in our organization about 8 years ago to teach people about systems and complexity theory, because one thing I see, and I think you'll see, is that in organizations, decision makers, they get together and they make decisions, and they have a certain language, and they have charts, and they have models of how the organization is working and how the world's working. And if you examine them, they look very linear, right? They're kind of graphs that go like this, and if we do this, we'll get that result, and so forth. And then it's very difficult, as you say, to stand up in that situation and say, well, maybe this is not right, or maybe there's a better way of doing things. Actually, you need a whole new vocabulary, quite a robust logic to really introduce that, to make people stop and think differently. You know, if you don't have a coherent logic, it's going to kind of get flattened really by a much stronger kind of linear logic. And that's what complexity theory and system thinking introduced. It says there are linear systems, but there are also non-linear systems, right? And we understand the linear ones very well. We use that logic very well. There is actually a whole logic about how non-linear systems work. Networks and decentralized systems and emergence and all of this. And if we can get that language and we can share it and we can build it in our organizations, then we find a different way of talking about these challenges, not just the linear approach, right? That, there's a problem there and we're going to fix it like this, but actually say maybe that problem's emergent, maybe it's systemic, maybe we need to think in networks and so forth. And that introduces a whole new way of thinking, a whole new vocabulary, which is really important if you're going to actually start to do things differently. Just putting your hand up and saying, I'm not sure about this, it's not going to get you very far. You really need that language, and then you need colleagues and peers to collaborate and work together around that, right? The people who are thinking differently like this, connect people.
Yeah, and I think this comment, Anthony's comment as well, unpicking 30 plus years of an approach is tough. And, this is, I think in the beginning still of having these types of approaches in the mainstream, let's say, for more people to actually be aware of them. And I think it's just through or events like these or organizations like Systems Innovation and others that are actually starting to spread this idea and this knowledge to then as trying to go back, we can see 30 years from now, and then this is going to be the comment that Anthony is having here, but maybe a bit more advanced, let's say. So yeah, I think it's just a matter of persistence and continuing having events like that and learning together and sharing this knowledge even more. So
I'll just say very quickly, just to build on that, these ideas were discovered in science around nonlinear systems and chaos and all of this about 50 years ago. And it was a revolution there back in the 70s, chaos theory, and talk about networks and nonlinear systems and so forth. And it was a paradigm shift in science with all the struggles and complications and difficulties of a paradigm shift. But they basically did it so that now if you go to university, you're taught about linear systems and nonlinear systems. And you're taught about models for both. Right? So it has happened in science, even though linear kind of thinking still dominates a lot. They did actually recognize that this is real. These nonlinear systems exist and so forth. So definitely it can happen in society, it can happen in organizations. It is happening, but it takes time, right? So it's just to say that, our thinking can change, and it does change, particularly as we bump up against all these complex challenges, right? And we recognize that these things aren't simple. So it's trying to introduce that into organizations. It takes time, yeah. It's possible.
Awesome. Yeah, so since we have just 4 minutes left, I will just share the Miro board again with you, so you can see the references, and here we have ways for you to connect with us at SI and in different way. So yeah, feel free to just drop us a message, and we're always more than welcome to have more deeper conversations with you.
There's a question there from Anthony, maybe. Is it more important to take this approach to rooms of people who get it, or rooms of people who are skeptical? Yeah, maybe you need to create some collaborators first, build some critical mass, maybe before you stand up in your board meeting and tell them they're all wrong and they should do something different. Yeah, I mean, definitely networking and building a community of practice, right? That could be a good way of doing it in your organization. Who's interested? Who wants to be part of this? And how do you expand that?
Exactly. Yeah.
Okay.
That's it.
Yeah, no, well, thank you very much, Yasmin and Joss in particular, for pulling this together and sharing your ideas. And like I say, the links are there, and I encourage everybody to sort of look, more in detail into what SI do. Like I said, great content sort of on the website, through LinkedIn, YouTube, tons and tons of content, really fascinating stuff. So thank you for your time. Equally, I think to Anthony's point, in terms of, who do we speak to about this? Like, you are the starting point. So I appreciate everyone's time sort of joining this call. We've got sort of 25, 30 people joined today. As this is happening, we've got another 28 people on the other side of Burnley talking around this exact, 28 senior leaders, all talking around the sort of exact same subject. So this is the starting point for us, and hopefully sort of the ripples to Anthony's point, will come from this. So I appreciate everybody taking the time to join. Thanks again to Yasmin and Joss. And just shameless link, I will put in the Eventbrite link. Hopefully the Eventbrite works next week, but the very next session is actually next week on the 3rd. So they come thick and fast. There's another one on the 10th. So the link that's in the chat, look on there. If there's anything else leadership based that's of interest, then please continue to support us. If anyone has any ideas of other content that people want to talk around, whether that's sort of systems change or any other leadership areas, then let us know, and we'll try and facilitate that the best we can. But for now, thanks everyone for your time. Much appreciated. Take care.
Thank you, everyone. Take care. Thank you, Heath. Bye.
Thank you.